If you like watching psychology content, subscribe to Psychology in Minutes. Have you ever reached for something to escape stress? A drink after a long day, a pill to sleep, or a substance to feel better? Now imagine needing it just to feel normal. That is how addiction often begins. Substance use disorder, or SUD, is a chronic medical condition characterized by the compulsive use of substances despite harmful consequences. It affects the brain's reward system, altering judgment, behavior, and self-control. Substances commonly involved include alcohol, nicotine, opioids, cannabis, stimulants, and prescription medications. According to DSM-5 criteria, SUD is diagnosed based on symptoms such as cravings and intense urges to use a substance, loss of control over usage, increased tolerance, requiring more of the substance, withdrawal symptoms such as anxiety, nausea, or tremors, neglecting responsibilities at work, school, or home, continued use despite physical, emotional, or social harm, spending excessive time obtaining or using substances, risky behaviors such as driving under the influence. Imagine someone missing important family events, struggling at work, or damaging relationships because they cannot stop using a substance. Addiction doesn't just affect the individual, it impacts families and communities. Now I know you want to know about the burning question: is addiction a disease or a choice? But before we answer that, let's discuss treatment options. Treatment often begins with medical detoxification, followed by rehabilitation programs, either inpatient or outpatient. Psychotherapies such as cognitive behavioral therapy, motivational interviewing, and contingency management are highly effective. Medications may be prescribed to manage cravings and withdrawal symptoms. Lifestyle changes such as exercise, balanced nutrition, and mindfulness support recovery. Support groups play a vital role in long-term healing. Organizations such as Alcoholics Anonymous, AA, and Narcotics Anonymous, NA, provide community, accountability, and encouragement. These are just options. You should always consider a professional. For therapy, consult a certified clinical psychologist. For medication, consult a psychiatrist. Now, the answer to the burning question: is addiction a disease or a choice? Addiction is a disease. While the initial choice may be voluntary, repeated substance use changes brain chemistry, making it difficult to stop without help. To support someone with addiction, avoid judgment and blame. Encourage professional treatment. Celebrate milestones such as days or months of sobriety. Offer practical support, such as attending meetings with them. Say, "I'm proud of you," instead of, "Why can't you stop?" Recovery is not a destination, it is a journey, and every step forward matters. Subscribe to Psychology in Minutes for more.